Hey guys, Dr. Josh Wagner here, coming to you with how to attract more new patients who want to pay you and pay you well without spending a dime. And I'm going to use this as a demo in a second to explain how to do this in your practice. So I was prepping, or I am prepping for a group coaching call tomorrow for patient mastery doctors. This is going to be the topic, and I want to share it with you because if you're watching this, you're probably a really, really great chiropractor and deserve to have a busy practice full of patients who pay you. You're happy to show up, you love being in practice, and it should be easy. And I'm telling you, I've never seen such a shift from beginning of May, when quarantine started to end, these past 2.5 months of doctors using patient mastery strategies, having such incredible rebound, many of them surpassing their best months of collections, volume, if that's the metric they care about, and it's just going so well. So, hey, what's up, Mark? Mark, you're gonna love this. So here's the story. Here's the example how to get more patients to find you, want to come to you, want to come into your practice, and pay you more easily than, for some reason, the chiropractic profession hasn't really shifted to and evolved to like every other profession has. So here's the example from this weekend. My girlfriend Christine, we took a staycation locally to detach, unwind. She treated, and over the weekend I wanted to get her a gift to show my appreciation. So I'm on Amazon looking at gifts, and I stumble upon this, which is a candle. Regular old candle. Nothing special or fancy. Smells like soap. It's a candle. And I figure she'll like it. And if you walked by one of those aisles in CVS or any convenience store, this would be like the cheap $3.99 candle. I spent $25 on this. Now, yes, $4 to $5 is going to be the gift wrap option and maybe the tax, but I think it was $19.99. I never ever would have spent $20 on this in CVS or name your regular shop that has candles. I'm not talking about a fancy candle shop, and this isn't a fancy candle. So why did I spend $20, 4 times as much normal, on this candle? Now, I want you to be thinking about your chiropractic care at the same time. And I'm going to explain it. I'm going to give the shift. Here's why. Now, you may not be able to read it because it's backwards in its script. It says, best mom ever. Now it's not just a candle. It's specifically for her. It's something that's meaningful to her, something she cares about, and something she'd really appreciate. How much did this label cost this company? Probably less than a penny to slap on all of these $1 candle jars. So it cost them nothing to do that. Now, it was a no-brainer for me to spend 4 times as much as the CVS, and she was 10 times as much appreciative. Now, how does this relate to your care? So most chiropractors and most people who teach chiropractors our profession, again, we haven't moved on even though every other industry and profession has, is we're trying to offer, sell, educate, convince, or get people, patients, prospective patients, on board with chiropractic. Now, remember, whether someone's never been to a chiropractor or you're their 5th, they already have their fixed perceptions. They think it is whatever they think it is. That's really important. And so many chiropractors beat their head against the wall or spend hours extra every week in the practice and end up actually confusing, turning off patients, hurting referrals, because we try to get the new patient to buy, invest in chiropractic in whichever way you want to describe it. Close them, sell them, inspire them, enroll them. That's really tough. It's a really tough fight. It's a really tough communication, trying to get people to change their perception on chiropractic. Listen, if they're coming to you, if they're willing to call you, go to your website and schedule an appointment, they've already got over their fear or apprehension or whatever it is. There's a certain amount of the population that's just never going to come to you, never going to be convinced. Don't worry about them. The people who already are coming to you, they're already on board. Now, that doesn't mean they're going to pay you, but you don't have to convince them on the anatomy, physiology, the philosophy, green book terms. You don't have to do any of that. They've already gotten over that hump. So how does this is chiropractic, this is what you're offering, how do you do that? Because when it took this company less than a penny to put that label on, how much does it cost you to change your website, to write on your recommendations form that the patient's gonna see and that you go over with them? Rather than just chiropractic, rather than chiropractic on your website, rather than verbally, how much does it cost for you to say an extra line? It doesn't cost you anything. Change your paperwork, put it on a website. It doesn't cost you a dime. What if you started making what you're offering, what you're delivering, what you're giving them a solution to their problem? So instead of them purchasing or getting chiropractic from you, they're getting the solution to their specific problem, as long as you're being honest and you believe you can help them. So, person comes in with chronic migraines. Are you offering them chiropractic care and trying to teach them and educate them that chiropractic care is the answer? Or are you letting them know, this is it, this is the big delivery? Are you letting them know that you have a specific, unique protocol based on years of experience helping people with chronic migraines to get them better? And that doesn't mean you're guaranteeing a solution or guaranteeing treatment or doing anything that's over the line of what you're allowed to say, whether on your website or in person. You're being completely honest. And suddenly, your care is a solution to their need, because they're not calling you for chiropractic care. They're calling you to get their headaches away, to get their migraines away, or get them better. The big disconnect with chiropractic and how schools teach it, how most management and coaches teach it, is we're trying to have this fancy script to get the person to now understand, believe in, and agree with chiropractic and tell people about it. Well, that'll happen to like 2% of people. But if you change and you go over to where they are, because all they care about, their pain is their situation, and you make what you're delivering about them, and you communicate that verbally. When you're going over the recommendations, it's specifically for them. You will see that patients will pay you far, far more and more easily, stay with you longer, refer other people, because what you're doing is the solution to what they want. This is the age-old issue with chiropractic. Someone comes in for this, and the chiropractor's offering this. How about someone comes in for this, and you say, I got you. Based on years of clinical experience helping countless patients with the same condition, I'm very confident in this amount of time, you're gonna see these results. There's no guarantee. You're being completely honest, as long as you believe that's true, and you have a track record of that, and you verbalize it, and it's written on the paper that your care is unique for their case, their condition, and their goals. All verbalized, all written out, and it's just a no-brainer. The person's like, this is exactly what I'm looking for. And they don't have to know how many vertebrae are in the spine. They don't have to understand nerve root impingement. They don't have to understand any anatomy, physiology, philosophy, green books, or the countless robotic scripting that most chiropractors do that just steamroll patients and confuse them and overwhelm them, and then I gotta go speak to my spouse about this. See the difference? Put the label on your care of what they're looking for, and patients will so much more easily understand it, thank you for it, pay you for it out of pocket, even when they thought insurance was gonna cover everything, and they find out they have a $5,000 deductible, or no benefits, or 4 visits covered, and then American Specialty Health dictates your care. You know what it is. When you change your mindset, you change your language, it doesn't cost you a dime. Everything in practice changes. People come out of the woodwork, pay you, stay, and practice gets so much easier because it's not convincing, it's not educating, it's not selling, it's not closing. It's, you've got the solution, you've got the answer. Who wants to come in for a ride? Yeah. And yeah, this is valuable. You're gonna pay for it because you're gonna get your life back. And it's fun and it's inspiring. Just like doctors who jump on patient mastery, who feel like they've been banging their head against the wall, whether they're at high volume or not and just making it, and realize, wow, like if I just think about the new patient relationship differently, use these strategies for the new patient experience, how to create my fees in the paperwork, people pay easily, out of pocket, refer, they're happy to pay. And just things get so much easier. So if you want more tangible understandings like this and like actually words to say how to do that, go to patientmastery.com, watch it's like a 45, 50-minute DC training. You will get stuff right in that to immediately put into practice, and you'll see a change. Right now, what can you change on your website? What can you change in your recommendations paperwork? What could you change in what you say to a patient that says what they're purchasing, what you're offering is the solution to what they want, rather than what you've spent years getting a degree for and years practicing, which they don't care about. They don't care about chiropractic. They want the solution. How can you change with your new patient this afternoon that what you're offering, what you're providing is the solution, the answer to what they want to get their life back? Which, by the way, doesn't mean once you do that, people can't continue on with chiropractic care because they value it, love it, see the benefit, whether it's from a wellness or maintenance standpoint. So that's not cutting that option off. You're just starting with what a new patient can actually hear and digest and easily want to pay you for. So I hope this made a difference for you. I hope, watch it again, go to patientmastery.com, watch the DC training, and put it into your practice. You'll see a change immediately. That's what I want for you. That's what I want for great chiropractors everywhere, because you deserve to have a busy, full practice that's fun, it's easy, and patients love you, your team, and paying you because it's so worth it. All right, be well, gotta get back to work. Have a great, great day.